I'm Inosha Bambaranda. I'm a fertility specialist at TFP Oxford. My role at TFP is to help people achieving their fertility goals. This would involve consultations and carrying out fertility treatment. As we all know, fertility is something which declines with age, so it's an important option for people who are not ready to start their family yet. It gives a backup for them in the future. Also, it can be an option for someone who's faced with a challenging situation where they are offered treatment which can affect their fertility permanently. There can be many reasons. It could be a medical reason where someone is starting cancer treatment or having a surgery which can have an impact on their ovaries or testicles. It could be a personal reason where someone is not ready to start their family yet. Or it can be an individual who's going through gender transition treatment which can have an impact on their fertility. So at TFP Fertility, we have years of experience on fertility preservation. There are three main options we can offer you: egg freezing, embryo freezing, and sperm freezing. If you are going ahead with egg or embryo freezing, this would involve around 2 weeks of medication followed by an egg retrieval process. If you're freezing eggs, eggs would be stored on the same day of egg retrieval. If you decide to freeze embryos, the eggs are combined with sperms to create embryos, and the embryos would be stored for future. With sperm freezing, you'll be given an appointment to come and produce a semen sample where it would be frozen to be used in the future. So when you first contact us, you'll be offered an initial consultation with a specialist where we discuss your concerns, discuss your options, and make a plan together. Then you'll be going through some tests, and also you'll be having a consultation with one of the nurses to discuss your medication. With sperm freezing, after the initial consultation, you'll be having tests to exclude some infections, and you'll be given an appointment to come in to produce a sample. So success of fertility preservation can depend on few factors. The first thing would be the age at which you preserve your fertility. As we all know, fertility is something which declines with age. And I would say the success rates are compatible with age-related IVF success rates. So the earlier you preserve your eggs or embryos, a better chance you would have when you want to use them in the future. The second factor which can affect the success is the survival of the eggs or embryos. Now, when you freeze eggs and when you want to use them in the future, the eggs need to be defrosted, they need to be combined with sperms, the embryos need to reach a specific stage for us to use them. So all of these eggs might not reach that stage, so we would recommend to freeze around 15 to 20 eggs based on your age. Now, what we know is embryos have a slightly better chance of surviving that defrosting process. And when you create embryos, you are one step ahead of eggs. You know the embryos are there when you want to use them in the future. However, with eggs, you retain the autonomy on decision making, whereas with embryos, you need two people creating them, so you need the consent of both partners when you want to use them in the future, unless you create embryos with donor sperms as fertility preservation. With sperm freezing, it depends on the sperm quality. Now, based on the sperm quality, you can use them for insemination of your partner or IVF in the future. So at TFP Fertility, we have a brilliant team looking after you every step of the way. Every individual is special to us, and we want the best outcome for you. We do have a dedicated team of counselors providing you with emotional support throughout the way, and you have easy access to the specialist at any time of the day. So my advice to anyone who's considering fertility preservation is do it earlier rather than later. If you have doubts, do always have a consultation with a specialist. You can always refer our website for further details.